So I've done a number of uh, systematic reviews. Some of the topics have been born out of existing research questions, and I think some of the most impactful systematic reviews are questions that the community, the perioperative community, are asking collectively. But there are some questions that come out of niche interest. So, for example, we're doing one at the moment looking at post-operative anemia and whether IV iron or oral iron affects outcomes. And that's come out of the desire to build a big trial. And so that systematic review will inform a grant application.
So thinking about the one that we are currently doing, I was on a guidelines committee where we're trying to come up with obstetric-specific monitoring guidelines for post-operative or post-neuraxial opioid administration. And one of the questions that was brought up by one of the committee members was, what is the incidence of respiratory depression? And the truth is that nobody knows in the obstetric population. So we then decided, after discussing amongst this group, whether it would be a good idea to do a systematic review to answer that question.
So for me, it was partly decided for me. So working with Neela, the big question when I started was how we were going to risk assess and risk adjust outcomes. So we needed to find a risk assessment tool for emergency laparotomies, which hadn't been done before. So it was an easy one.
The topic I decided upon was based upon sort of clinical experience. So at the time, I was a trainee anaesthetist. I was working a lot of time in day surgery, spending time working on my own and also with different consultant colleagues, as per usual, all of whom having their own style of giving their anaesthetic. This was just a way of answering a question which I had. So my systematic review was comparing inhalational versus intravenous anaesthesia in day surgery, and so I think just to try and come up with some answers of what was better to use.
That came about actually just talking from colleagues. So the other co-author I had were chatting about different RCTs that we could possibly do in obstetric patients for analgesia. I am a regional anesthesia enthusiast, so we were heading towards regional anesthesia-based topics. And that came about, and then TAP blocks, transversus abdominis plane blocks, the topic came up then because of this discussion. And then that's when we felt actually all the data out there, and there are hundreds of TAP RCTs and meta-analysis, but none of them really looked at the doses that could be helpful in obstetric anesthesia. Everyone looked for efficacy of TAP blocks, everyone looked at technique of TAP blocks, but there was a gap there with this form of anesthesia or analgesia for obstetric patients. So that's how we formulated the topic.
Well, I was lucky there in that I was available as a research SHO, and I bumped into Monty Mython, and he was interested in a question, and he let me explore it. And then once he guided me towards the topic that he thought was most interesting, we then, myself and some members of the team, managed to narrow the question down more and more until it was a really sharp, honed question. So I guess it was a period of a couple of months of reading around, plus some guidance, plus some expert consensus.